Hello and welcome to the TMDSAS podcast. My name is Enrique Hasso, Coordinator of Research, Advising Services, and Digital Media at the Texas Health Education Service and TMDSAS. We're here to help you engage with advisors, directors, admissions staff to help get tips and tricks on how to submit the best possible application to TMDSAS. We'll also connect you with TMDSAS staff to help you get your application to schools without delay, explore the TMDSAS application in greater detail, learn more about the medical, dental, and veterinary schools that participate in TMDSAS. Our apologies with the last half of the discussion. The cleaning staff was very eager to clean the room, but we wanted to make sure to get all of the information that Dr. Kellaway wanted to share. Let's go ahead and listen in. Today we're joined by Dr. Judianne Kellaway from the Long School of Medicine, formerly the University of Texas Health Science Center at San Antonio.
Hi, Enrique.
Hi.
Thank you so much for having me.
Thank you very much for volunteering to be our first guinea pig.
Welcome. You're very welcome. We'll have fun.
I think so. I really do. So I've got some questions that we have lined up. Some of them are submitted by some students. So we're going to go ahead and dig right into it. So first off, if you mind sharing a little bit of your academic background.
Okay. I am a Houston native, born and raised in Houston, Texas. I went to undergrad at University of Houston, and I was an education major. So before I got into this medical arena, before medical school, I taught early childhood and kindergarten in Houston for almost 10 years while I worked on a master's, also at U of H, go Cougars. And I was in a master's in education. I was still working with the kids. I had obtained the master's rather. And I started working on a PhD and exploring those options. I had an option to work with kids with particular issues, work with individual children who needed help. And a little voice at the back of my head said, maybe you want to do this through a medical route. And another little voice on the other side of my head said, I don't know if you can do this. So anyway, after a lot of contemplation and soul searching, I gave up teaching kindergarten to go into a lab and assist with some research and do prerequisites as a post-bac student, and applied, and here I am. I went to McGovern Medical School, and before it was McGovern, it was University of Texas Health Science Center at Houston.
At the Texas Medical Center.
At the Texas Medical Center, and spent my career there in ophthalmology. So I went into medical school thinking I was going to be a child psychiatrist and help individual kids with their issues, with problems. And we had the ophthalmology lab day, and I got a hold of that gadget and looked in the back of my friend's eye and saw the nerve and saw the blood vessels and said, okay, I love it. I can do this forever. So I was ophthalmology faculty for the longest time there.
And now you're over at San Antonio.
And now I'm at the Long School of Medicine in San Antonio. Isn't that wild?
That is.
Yes.
You took the scenic route.
Yes, that's right. That's right. It took us a long time to get there, but we're so happy.
Finally made it.
Yes, finally made it.
Great. All right. We've just discussed your academic background. Could you share a little bit about your experience with admissions?
Yes. So actually, I had a friend. I was a new faculty member. I stayed on at Houston after ophthalmology and worked with residents, was teaching the medical students ophthalmology. And a friend was headed to a meeting. It was lunchtime, and we ran into each other. And he said, come with me. I'm going to committee. You should see how this works. So I joined Dr. Mark Farney at an admissions committee meeting, and that was the beginning of another love.
Great.
So, yeah.
Fantastic.
That was in the 90s somewhere. So that's how I got into admissions work.
All right, fantastic. Well, our next question that we have actually comes from a student, and the question is, why did you choose this institution, meaning the Long School of Medicine, and what really attracted you there, and what do you feel keeps you there?
our journeys are, each of us have this path that we're on, and it's just so interesting to see the twists and the turns. I feel like when I look back, I can see the twists and the turns that were leading me right here to this wonderful dream job that I have. I left, obviously, some deep roots in Houston, way deep. I left my mom and my sister and my BFF and students and residents and patients. But this position became open after my friend and mentor, David Jones, decided that he would go off into another adventure. And I weighed it carefully. That's a big decision to make, to move from somewhere you've been forever. Right. Know the system, know the players, very comfortable with the setting and the work I loved. But to have this opportunity for a whole new adventure, that was one reason, was the adventure itself. Yes. The new opportunity to come to this school was very exciting to me. But then you have to research it, and everything I researched about the school, of course I knew it from years in admissions and working with the advisory deans council and that sort of, and JAMP, of course. I knew, I thought I knew a lot about San Antonio, and I knew some things about the medical school in San Antonio, but the more I learned, the more I investigated, I found a place that was doing really high quality work, had some great initiatives, wonderful newish curriculum, and great people. And that all helped that difficult decision to leave, but made such an exciting opportunity also.
Great.
So
I'm glad you brought up curriculum, because that's direct lead into our next question.
Okay, great.
Can you
Good
tell us?
segue.
Yes, great segue. Could you tell us a little bit about what the curriculum looks like at the Long School of Medicine?
Yes. I really would put this curriculum up against any in the nation. It is, we can't really say that it's a new curriculum anymore. Our curriculum was completely revised in 2012, and so we have graduated a class already who has been through the modernized curriculum. Like all new curricula, these days we have a few emphases. A huge team got together. As you can imagine, it is like turning the Titanic with paddles. You know, I mean, it's a hard thing to do for an established school, to get everybody's mind, these wonderful teachers who've been doing a great job anyway, to wrap their minds around a new and more progressive and modernized way to do things, was quite a task. We're very solidly founded upon educational principle. So they started to create this curriculum by asking the question, how do adult learners learn best? And so every component of the curriculum is tied to that question about adult learners. So what we've done, like so many modern curricula, we've minimized lecture hours. Passive learning we think is not as effective as active learning. So there's another emphasis on active learning, getting into the discussion, getting into the activity to augment the learning experience. We have a focus on teamwork. And I think we put our money where our mouth is in terms of teamwork, because some of the team tests or quizzes, we do another fundamental principle is feedback, retrieval. In other words, testing and quizzing is very important to help a student know where they are in that learning process from early on. So they get a few quizzes a week, but the team quizzes count more.
Great.
We want students to be in experiences where they're working with each other.
That's very reflective of medicine now.
Yes,
It's
exactly.
a team effort.
Exactly. All the specialists, all of the health professions, people that help care for one patient and their families. It's huge. So we do have to learn how to communicate, learn what each team member brings. So that's very important. It's very important. I think we do tremendous step prep. We give 4 opportunities for full-length tests for the there's sort of there's a PSAT, there's also a pre-step 1. So we give 4 opportunities for that. We identify the few students who might need a little extra guidance and help. We give them individualized study plans early on. We have great support from Student Affairs and the Education Office as well. I could really go on and on. The clinical education is just as strong, with many sites, lots of opportunities for exploring various specialties.
So that team-based learning is fully integrated.
Yes.
That's fantastic.
Yes. It's great.
Wonderful.
Yeah.
All right. Well, I think that is one of the things that makes San Antonio a little bit unique. Could you go a little bit further and kind of identifying some of the key areas that make the Long School of Medicine a unique institution? Sure.
If I just back up to curriculum a little bit, and I can go into other areas, we still have, for example, a traditional cadaver dissection for the basis of our anatomy education. And we believe that that's important. That's your first patient.
Yes.
You know, when the student comes to that lab for the first time to lay hands on this person who has donated their body to science, there's great dignity and respect, and it's just a great educational experience all around.
Absolutely.
But that is augmented by a software program, a robust software program called BodyViz, and that's just catching on across the country. So we do augment our traditional anatomy with this virtual anatomy system. Your cadaver may not have a tumor of the circle of Willis, but in the software program you can look at that a tumor and rotate the body to look at the anatomical configuration, and I think that's a great thing.
You get exposed to a lot more nuances of the body that way.
Yes. We try to cover, I think one other feature of modern curricula is really tracking and feedback. So are the students meeting all of the hundreds and hundreds of things we want them to learn? So you don't miss out if your cadaver does not possess some certain anatomical feature, or it's disrupted,
right,
shall we say, in the dissection. We can reproduce that digitally. We have e-books. We have 2 clinical skills labs. We have a longitudinal full 18-month curriculum in clinical skills. So our students will learn to do a full history and physical exam in the first semester. So by the Christmas or winter holidays, they can do an H&P. But we don't stop there, and we use the next period of time during those preclinical months to delve deeper into the complexities required in a higher level of examination. So each body system, has we can really get into a detailed exam of the heart and the lungs and regular system, other systems rather. So
that's fantastic, being exposed to that so early on.
I think it makes our students very good, very, very good clinicians,
Absolutely.
We have a strong component as well in our Center for Medical Humanities and Ethics. So the professionalism, the professional identity, and the formation of our students' professional identity is something that we pay great attention to.
Great.
I tell them on interview day that you are professional. Look at you. You've got your suits on, your phones are turned off, you're sitting up straight, you're paying attention, all wonderful professional behaviors. But medical school is going to challenge you to reach higher and higher levels of professionalism. It's hard. It's hard academically. It's very difficult in the clinical years when you're trying to care for a patient who may not be able to follow your directions, or who doesn't understand what you're trying to convey to them, or you're in a situation where there's a tremendous amount of stress or sadness. That's a lot to deal with, but certainly will help a student grow in their maturity and in their professional self. And that's going to happen wherever you go to medical school. Right. But ours, like so many others, we pay attention to that professional growth and make sure that they've got people at their side for talking through all of these experiences, the difficult times and the rewarding times as well, with fellow students and students who have been through it before. And then, of course, their clinical faculty are right there as mentors also.
That's wonderful.
Yeah, so lots of good things happening. Our medical school location, I think, is very important. And if we talk about the greater community, we serve South Texas, so we have a very large medical center area. But for example, our hospital is a level 1 trauma center, not just for the surrounding areas or surrounding counties, but for the entire South Texas region. Wow. Which gives our students, of course, a wonderful experience, but we also feel terrific that we're providing great care for so many.
Yes.
And so many of those counties and so many people in that area are underserved in terms of their medical needs, and we're so thrilled to serve them. We're the only level 1, so the level 1 trauma for adults covers the whole South Texas region, and we are the only level 1 pediatric trauma center for that entire region. Wow. So we feel like we give good care.
Great.
It's also, let me throw this in there. As a student who's busy in medical school with devoting so much of your life to study, it's a great place to be. San Antonio is just a great place to be. Can I go into that a little
Absolutely.
bit? Absolutely. So I really didn't, San Antonio was a place where our family went at least once a year. SeaWorld and the Hill Country and going to El Mercado, and those made lots of fun family memories for me. Oh, the 3rd grade, Texas history tour, right. To the Alamo and the missions. So there are so many great things, but people think of the Alamo and the Riverwalk and SeaWorld, I think. But oh my goodness, the city has so much more to offer.
Like a small town feel in a large city.
I'm so glad you said that. Because that's exactly what we say. You can see, a lot of people don't realize this is the 7th largest city in the United States.
Really?
Yes. I'll throw a few stats at you. It is the metropolitan city where more millennials are moving than to any other metropolis in the U.S. So it's a young city. I like that because I think young people bring vibrancy and ideas and acceptance of new ideas. So I like that about our city. We're also, I think people don't realize that we're the 2nd largest city in Texas.
Yes.
So I was glad to hear you say that, because we say you can look at us as a big city with all the charm of a small town, or you can just think of us as a small town with all the benefits of a large metropolis.
Best of both worlds.
That's right. We've got theater and comedy and great places, all kinds of restaurants. There's a new development, relatively new, called the Pearl Brewery. It's centered around the Culinary Institute. There are 3rd branches in San Antonio. So, oh my goodness, there are like 19 restaurants, 14 very cool shopping places. People bring their dogs, walk around. There's a farmer's market. It's just a great place. There's a lot going on.
Work hard, play hard.
That's right.
Yes.
That's right.
All right. Well, the last segment we want to talk about is... So the last segment we want to talk about, a lot of students develop myths and bad advice everywhere. So we're trying out this Mythbusters.
Okay.
Medical School Admissions Edition. So I'd like for you to kind of pick your favorite myth and bust that myth.
Okay.
So if you could share that with us.
Okay. So there are probably a few we could tackle. This might be a timely one, though. This is a cycle. We're just post-match. We have still several months to go before we all matriculate our classes to to start entry year of 2017, the class of 2021. One thing I would like to help people with, to help an applicant with, is that, and so many applicants do think that the holistic review means that they can take their wonderful attributes, their personal attributes of maturity and responsibility and resilience and fortitude and industry, which are all wonderful, and they can add that to their fantastic experiences that they've sought out in healthcare. I call it apprenticing instead of shadowing, because it's a more active word. Anyway, they can take their experiences at the side of a physician, watching them caring for people, their volunteer experiences, their leadership activities. Those wonderful things still do not make up for low metrics. I think all committees are looking for a balance of all those things. So when we see such strength in the attributes and the experiences, we still need to see some strong metrics to ensure that a student can be successful. They do need to sort of prove that they can be successful in medical school.
Right.
So this is a time when we are hearing from people who are, and it might be a little bit early for some. There's still a lot of waitlist movement, but people are asking now, how do I strengthen my application? So we're looking for a nice balance of all of those things. Experiences, attributes, and the metrics are important also. And so I encourage people to look at national, state, and school averages in terms of the numbers. And there are all kinds of ways to help boost those things. But that is one misconception, I think, that is held by some.
And we'll be posting a link so that listeners can take a look at the TMDSAS statistics and the distribution, so that they can see where they stand as well.
Yes, I think that the new MCAT, still has to prove itself. We need to see what's predictable. We knew the other MCAT, and we knew what predicted success, and we want everybody, once they're in, to be successful in medical school.
Right.
So I think it's very helpful to look at the applicant pool and the pool of applicants who obtain an interview, as well as the wonderful students who finally gain acceptance. And I would say, let me just throw a word of encouragement in, because that didn't sound very positive, that just to hang in there, There are so many applicants. There are ways that people don't make it the first time. We just have so many applicants. You need to apply early. I hope you'll show some of those. We'll spread those statistics around.
Absolutely.
Also. And anyway, you just need to apply again and try again. We know great doctors who have applied several times even, so I applied 2 or 3 times, long ago. And you just have to work. You hold your dream in front of you, and you make progress every day towards it. Write down some goals. Setting goals is key. People who set goals are proven to meet them at a higher rate than those who just sort of think about them.
Right.
So I would encourage that. So
great advice for applicants.
Good.
All right. Well, Dr. Kellaway, thank you so much for helping us out with this first TMDSAS podcast.
You're very welcome. Thank you. I was so happy to do it. Enrique.
Well, thank you so much. And we'll be sharing some of the notes that Dr. Kellaway shared with us. Again, this is Enrique Hassa with the Texas Health Education Service, TMDSAS. Thank you very much for listening.